Okay, so I'm Dr. Smith. We're going to simulate the patient experience like you're having surgery. So these would be the steps that we go through on the day of your procedure. We're starting out by the main entryway. This is the entry into the Arnett. We're going to walk right through the main doors. And go through the COVID screening. Hello, I'm here for surgery. Thank you very much. Registration is over to the left. I'll come right over this way. Hey, good morning. I'm here for my surgery.
What can I do for you?
I'm here for surgery.
All right. And what's your name?
Dr. Smith.
All right. Step right over here.
Okay.
I just have a consent form for you to sign for billing and treatment.
Okay.
The pen cleaned off for you. All right.
Oh.
There you are.
Thank you.
It's billing and treatment, and it also includes your privacy rights.
Thank you.
And I have a wristband for you, just so I can make sure I have the right person. What's your name and date of birth?
Dr. Smith.
All right. And you're going to head right into this waiting room, and someone will come down and get you. I'll give them a call right now.
Thank you very much. Once we're all checked in, we'll wait for the surgical staff to come and get us. All right.
Mr. Smith?
Good morning. Absolutely.
Hi there. Are you here for surgery today?
Yes, I'm here for surgery.
Okay, then I'll have you follow me up to date, sir.
Wonderful. Thank you
Get
so
all
much.
ready.
So someone's coming down to meet us in the lobby. We're going up to get ready for the procedure itself.
So how are you feeling about today?
I'm nervous but excited. I know I'm in good hands.
Good.
We are on the surgical floor.
Have your room all set up, so we're going to go to room 8.
Wonderful. And this is the same day surgery pre-op and post-op suite.
I'm going to have you have a seat right there.
Okay.
So I'm
Sure that's
Dr.
good?
Smith. They're checking my identification to make sure I really am who it says I am. And at this point, we're doing all the preoperative checklists to make sure everything is as safe as possible for surgery.
So we're going to get your blood pressure. You want me to actually do your blood pressure?
Let me just push the thing. So we're going to check my blood pressure,
I'm going to get your oxygen sat.
testing my oxygen level.
And your temperature,
And also my temperature.
98.3. Okay, good. 137/80.
And I passed that test.
I'm going to set this machine over here because I like to get it washed before I put it in the hall for somebody else to grab. So I'm going to get you all ready. So that includes doing the decolonization process.
So now we're going to talk about all of the preoperative steps. The first one is going to be the preoperative decolonization process, which we'll go through in detail later.
I'm going to, once you're in your gown, I'm going to have you get into the bed. And I'm going to do your physical. I'm going to listen to your heart and lungs, bowel sounds, check pulses.
After we do the decolonization protocol, we'll change in the hospital gown and go through the preoperative physical exam, checking my heart and lungs.
And then I'm going to update the profile that they started in pre-admission with all your history, last time you took your medications, your allergies, just verifying everything's correct.
We'll go through and verify my medical history and medications.
Okay. And then I'm going to educate you on what's going to happen throughout the process.
And then they'll give us some education on what to expect moving forward.
Okay. And then once everything is done, I'll let the OR know you're ready. And then your surgeon's going to come in and talk to you. The anesthesiologist will talk to you, and the final one will be the OR nurse who will come in and do one final verification. Your name, your birthday, your allergies, what you're having done. Make sure the paperwork's complete, and they will wheel you to the operating room.
And once that's all set, my physician will come in, the anesthesiologist will come in, and finally the OR nurse will come in to transport us into the operating room.
Hi, it's Dr. Jarvis again. At this point, you've made your way up through the hospital and you're on the same-day surgery unit. At this point, myself or one of the anesthesiologists or your specific surgeon for your surgery will be coming into the room to meet you, as well as mark your extremity site, as well as go over any further surgical forms. So from here, we'll be coming into the room, again, myself or anesthesia team. How's it going, Dr. Smith?
Good, Dr. Jarvis. Ready to roll.
Are you ready for surgery?
Absolutely.
Any final questions at all that you'd have?
Nope.
So it is at this point, prior to going back to surgery, you can address any final questions you may have with myself, any of my colleagues, or even the anesthesia team. Here we'll mark your extremity site with our initials and make sure that you're not marking your site yourself. We'll take care of all that here. At this point, we'll move forward and get you back to the OR.
Good afternoon. I'm Ricky Hall. I will be your driver for today. All right. Is there anything I can do for you before we leave? The bathroom? Are you warm enough?
All set, thank you.
You're welcome. Can you just identify yourself before we go?
Dr. Smith.
Thank you so much. Here you go. This will be your doctor, Dr. Jarvis. And we're just going to go in first, okay?
So now you've made it to the OR. At this point, you'll be greeted by our nursing team, as well as our anesthesia assistant and the anesthesiologist. At this point, depending on the type of anesthesia that has been determined for you from the anesthesia team, we'll begin initiating the anesthesia process either on your bed or getting you transferred over here to the OR table and getting you positioned for surgery. You've made it this far, the rest is smooth sailing from here. So once your surgery has been completed, you'll be here in the recovery room for a period of time following your surgery and your post-anesthesia recovery. Once you've completed your time here in the recovery room, you'll be transported back to the same-day surgery unit or up to the floor, depending on the type of surgery you've had, for your full recovery.